Scientists in the US say losing the ability to smell could be an early warning sign of dementia. Almost 3,000 adults were tested as part of a long-term study involving waving so-called sniffing sticks. Researchers concluded that people who couldn't identify the smell of peppermint, fish, orange, rose and leather were more than twice as likely to develop dementia 5 years after. Well, I'm now joined by the lead researcher, Professor Jayant Pinto from Chicago University. Thank you for being with us. Just tell us how significant this research is in determining if someone has dementia.
Well, as you know, dementia is a big problem worldwide, and so we need tests to identify who is at risk for dementia. We don't have very good ones right now. Because the sense of smell is closely related to the central nervous system, we thought it might be a good indicator of future brain problems.
Just tell us why someone's loss of smell, how is that linked to dementia?
Well, that's one thing that's going to follow from this research is we know that the sense of smell, as it declines, really indicates future health problems. Connecting the two dots of what is the mechanism between those two things is something that we're going to be working on now, and many other researchers are working on worldwide.
And is it something particular about these specific smells? You said peppermint, fish and orange. Is it those smells in particular, or is it smell in general?
It's smell in general. We picked those 5 odors to be something that was feasible in about 3 or 4 minutes to test in someone's home. These were people all over the United States that were interviewed in their home. And so those 5 odors are representative of a full 16 battery of odors that is used in a clinical test.
Do you think this should be included in clinical testing when determining if someone has dementia?
Well, I think it's too early to say that. I think this can be one sensory system that clinicians can use as part of a range of tests and examinations that can be used to identify people who are at risk.
Now, it's estimated that 50 million people are living with dementia around the world. That figure is only likely to rise. Just give us a sense of how big a fight there is in terms of getting on top of this issue.
Well, there's a huge amount of research going into this worldwide. There have been major drug companies that have poured millions and billions of dollars into drugs to treat various forms of dementia, Alzheimer's in particular. And many of those trials have failed because, perhaps because they're treating people when the disease process is too late. So if we could start treating people earlier, intervening earlier, then maybe we would have better success. And so this test might be one way to identify people at risk to be so that those people could be tested for interventions.
So where do you go from here?
Well, we're going to be looking into the mechanisms of this. We want to see if we can make smell testing easier so that clinicians could test this much more easily. We all know you can go to the eye doctor and get an eye test. We all know that you can go to the otologist and get an hearing test. And we want to be able to have easy access to smell testing for general practitioners worldwide.
Professor Jayant Pinto from Chicago University, thank you very much.